Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Probenecid. Probenecid are also sulfenpyrazone. This probenecid or sulfenpyrazone, these are also uricosuric. These causes excretion of uric acid into the urine. And the probenecid and sulfenpyrazone uses are it can cause tophi, or it is important it can cause frequent gouty arthritis or gout attacks may be seen, and it can result in gout which is refractory to allopurinol. It is used in gout refractory to allopurinol or febuxostat. That is, even after using allopurinol and febuxostat, if the gout attacks do not recover, if the patient does not recover, or if gout attacks are still occurring, then we can use this probenecid and sulfenpyrazone. It will also prolong the penicillin action, and this probenecid can cause a side effect because it is a uricosuric agent. It can cause crystal formation. In order to prevent this crystal formation, we will have to give the patient adequate fluids, and fluid therapy should be given for prevention of crystal formation.
thank you and thank you for watching.